The pulmonary rehab, since it was started, like I say, in 1996, had strictly COPD people. COPD encompasses emphysema, asthma, any obstructive pulmonary disease is considered COPD. From smoking, from environmental pollution. Now it's opened up so much, it's opened up to a lot of different people. Bronchiectasis, which is mainly eating away, eroding of the airways. We can have lung cancer, we can have now lung transplantation people that can come into us.
The patients come in for an evaluation with me down at the outpatient clinic initially, and we sit down and hit main components. We address exercise, breathing, people are still smokers, psychosocial, many different aspects, and we go through each component and see what each individual patient has. So it's a very individualized treatment plan for each patient.
The class itself meets 3 days a week, Monday, Wednesdays, and Fridays. They come in, we do a light stretching, we do a little bit of light weight training. We use TheraBands for our weight training, which is a big elastic band, basically. Then we take and start the person up on either a treadmill or what we call our new step.
Once a week, we do an education component with our class, and some of the topics we address are stress management, coping skills, ways to make yourself happy, things like that.
The relationship between the lungs and the heart, basically, I call them married. So the heart, it pumps the blood around, but it's pumping oxygenated blood, and where's the oxygen come? It comes from the lungs. So if the lungs are not functioning properly, the oxygen itself does not get produced as much as it should. The heart is going to beat faster, calling for more because the body needs more. Therefore, the lungs are going to have to try to work faster and harder and deeper to be able to produce this oxygen. It needs to be a good combination of the two.
We have had patients that have gone through the cardiac program and they have an underlying pulmonary diagnosis, and they will, if they're still having trouble with their pulmonary functioning and their breathing, they will then come to us and go through a course of pulmonary rehab. And inversely, we do have a lot of pulmonary patients that go through cardiac rehab, because a lot of times you see the problems going hand in hand.
Just got notice that we have been first time through, we've met criteria, and we now are a certified pulmonary rehab program. I call it going from a 2-star to a 5-star hotel. As far as with the fear factor that we were talking about, that is to us one of the biggest things that we find that we have to work with. The person's body can do it, but the mind is telling them they can't. If I get up, I get short of breath. If I do this, I get short of breath, so I won't do anything.
And I think also that social factor and support, you know, they're in a group with other people that have a similar issue and they can relate to one another and use each other for support.
But what we see is coming into pulmonary rehab class, on that first day, they're scared, they do hardly anything, but I'm telling you, by the first week into the second week, these people are walking in with smiles on their faces and they're ready to go for it.